Cannabis, next to alcohol, is likely the most common drug you'll see in your paramedic career. It's an incredibly common drug, and even before it was legalized, loads of patients were taking it. However, we learned earlier that alcohol can have a whole bunch of nasty effects. Cannabis is arguably harmless. The symptoms are relatively mild, you can't really overdose on it, and the withdrawal symptoms are pretty non-life-threatening. It seems like a pretty great drug. But let's have a deeper look at it and see how it works before we rush to any judgment. Throughout the body, we have a vast system of receptors called endocannabinoid receptors. These receptors are found all over the body on a variety of organs and have a variety of functions. They are broadly broken into two types: CB1 receptors, which affect the central and peripheral nerves, and CB2, which focuses more on immune cells. So these receptors are interesting in two ways. First of all, they don't travel the same way that neurotransmitters travel. When a neurotransmitter comes from a sending neuron and finds a receptor on a receiving neuron, that receiving neuron can release an endocannabinoid, which then flows backwards and binds to the initial neuron's receptor there. It's this backwards relationship that tells us that the ECS is responsible for regulating other systems. The second interesting part is that the receptors have different effects depending on where it is in the body. Some of them will increase the amount of stimulus sent out, and some of them will reduce it. And sometimes that will change based on the neurochemistry of the body. This somewhat explains why taking marijuana can have different effects for different people, and some people who use it regularly can have different experiences between uses. So that's the ECS system normally. But how does marijuana affect this? Well, marijuana has two components: tetrahydrocannabinols and cannabidiol. THC is the easy one. It affects the CB1 and CB2 receptors all over your body and causes a variety of effects, typically euphoria, lethargy, reduced pain, and appetite stimulation. However, everyone's different, so some people experience severe tactile sensitivity, anxiety, and even paranoia. CBD is a little trickier. We know it doesn't affect the CB1 and CB2 receptors directly, which is why CBD typically doesn't give you the high-like experience that THC does. But we're not sure exactly how it works, other than that it does affect the ECS. One theory is that CBD affects how we metabolize the other endocannabinoids, or it affects their reuptake, but the research here isn't clear. Typically, CBD has been found to decrease pain, GI issues, and anxiety. So what do we know? Marijuana is a pretty safe drug based on its symptoms. At worst, there's some anxiety and paranoia, and some severe munchies. There's some dependence issues, and habitual long-term use does seem to have some cognitive impairment, though withdrawal symptoms are usually pretty minor. It's just some worsening of GI issues, pain sensitivity, headaches, and difficulty sleeping. There are two conditions that we should be aware of when it comes to cannabis. The first is cannabinoid hyperemesis syndrome. So this is defined as a severe and clinical episodes of nausea, vomiting in patients who have prolonged cannabis use. It's usually shortly after taking the cannabis. There are a few theories on the pathway of this or the pathology of this, with the most common that chronic THC stimulates cannabinoid receptors, overstimulating the GI system. Treatment for these patients consists of antiemetics like Zofan or Maxaram, and patients often report that hot showers or baths relieve the symptoms. There's even a lot of research that says capsaicin, like chili peppers or chili powder, is a viable treatment for CHS. The last thing we should worry about with chronic marijuana use is the link between cannabis and psychiatric disorders. This is a theory that chronic marijuana use, especially in young people, can incite delusions and episodes of psychosis and even cause schizophrenia. Now, this sounds really bad, obviously, but the research here really isn't clear, and it's anecdotal at best. It's unknown if the delusions or schizophrenic episodes are caused by the cannabis, or if the patient already had schizophrenia that was exacerbated by the drug. It's also worth noting that the schizophrenia typically presents in patients 25 years and younger anyways, which again doesn't tell us if these patients had schizophrenia initially or if it was brought on by the cannabis.